Allow me to welcome you all to our last and final module on radiology and radiotherapy for student nurses. Once again, my name is Mr. El Chitumba. I hope you had an appreciation of the first two modules that we have covered so far. So this is our final module. So in this module, we are going to discuss on the types of radiotherapy and then the precautions against radiotherapy, the effects of radiotherapy to the patient and to the caring nurse, as well as the care of patient who is on radium treatment. So what are the basic types of radiotherapy that we have? So radiotherapy can be divided into two major groups. So the major group that we have are what is called internal beam radiotherapy, and you also have got what is called the external beam radiotherapy. So what is the difference between the two? So essentially, when we're talking about an internal beam radiotherapy, we are saying that the source of radiation is actually put inside your body, and then it's going to produce radiation from inside, and then that radiation is then going to cause the therapeutic effect from inside. And then we're talking about an external beam radiation. We are saying that we have got a machine that is actually producing radiation from outside, and then that radiation is then used to treat the specific type of cancer that one is presenting with. This is just an elaboration of what I was talking about. I'm not going to go into the nitty-gritties of this information. I just want you to have an appreciation of what radiotherapy machines we use are and the different types. So under the external type of beam radiation, we do have got what are called the accelerated beam radiation. We also have got the 3D conformational radiotherapy. So these are just the subtypes that we have currently, which are in use in the markets. Of course, we do have got different brands from different vendors that we can find. So it all depends on the department that you'll be working with or that you'll be dealing with to see the types of machines that they will be using in the particular instances. So under the internal radiation types, which is also called the brachytherapy, we have got what is called the interstitial brachytherapy. This type of radiotherapy, the source of radiation can actually be put maybe under the skin. Then it will produce radiation from there. Then we also have got what is called the intracavitary brachytherapy. In this case, in the openings of the body, they can actually use those as roots or to actually put the radioactive substance in your body. Like you can swallow it via the mouth, it can be via the anal part. So those are the intracavitary portions or the vaginal portion. So it all depends on where they are placing the radiation source. So the radiation source in the internal radiation is actually inside your body. So you are actually acting as the source of radiation. So when we are having precautions against radiation, we are protecting radiation against you as the patient who is producing the radiation. Those are the source of radiation. So all other precautions that we're talking about in terms of radiation protection, we are protecting ourselves against the person who is carrying the radiation source. Whereas when you're using an external beam, we're worried about the machine protecting one against the machine that is producing the radiation that is being. So these are the machines or types of machines that we have. In terms of our internal radiotherapy, you can actually see this type of a machine. So here, the person or the patient is the source of radiation. So this patient is actually producing radiation from the body that has been implanted or that has been placed in the body, and then the radiation is going to be detected here by the detector here to see the amount of radiation that is being released or produced by the patient. So when I'm talking about an external radiotherapy, you can actually see that this is the machine that we have and the patient is lying here. So it's actually this machine that is going to produce the radiation that is used to treat the specific site or the cancer that will be presenting on the patient, as you're seeing. So the difference being radiation is coming from the machine or either from these this side, that side, or that side, or it can be from all sides. Then it's going to treat the cancer. And then when talking about internal radiation, it's actually the radiation source that is placed inside your body and is producing radiation from the inside. Then radiation is being emitted to the exterior. What is the care of patients undergoing radiotherapy? So for one to know that they've got cancer is something that is innate in me. That is difficult for one to cope. Even myself, it's very difficult for me to cope when I'm told that I have got cancer. So we are talking about a vulnerable group that needs a special care. So how do we care for patients undergoing radiotherapy? So if these patients have got children, they need to be supported to make decisions about how and when to talk to their children. So you also know that the emotion can also affect the children as well. So they need to be supported when and how to communicate with their kids as well. They need that help, because they can actually say information that can affect the kids. Maybe they'll be going to school, so they need to be to communicate with them in a way that is not going to jeopardize or actually put the kids at unnecessary anxiety. There's also need to support in the guidance and appropriate resources to inform these decisions and to help make difficult communication easier. So there's these people, they need direction, they need guidance. They might say, maybe I was renting where I was, they know my kids are there, and this cancer treatment, they need a lot of money, I don't have money for the fees and all. So they need also support if there are other measures that you as the nursing patient or can actually help or can give advice on in the appropriate resources that can actually help them to inform the decision that they're going to take in their life. At the same time, radiation technicians and radiation oncology nurses are able to support patients by asking, acknowledging, giving appropriate resources, and referring for additional support in a timely manner if necessary. So at times, when these patients are getting their treatment, they also need advice. You as the patient who has got the knowledge, you also have to advise them accordingly, maybe where they can get other additional help, and maybe the relevant medical practitioner, oncology doctors that they can visit or that they can get at their various places where they are coming from. So you can see that we are dealing with a very special group of patients that needs very critical care, because they can be carrying radiation. They are also afraid of radiation they are carrying. At the same time, they are afraid of the cancer which they have. So they need that moral support. They need that support. So you must not scare them or ill-treat them as a vulnerable patient. So now we are moving on, and we're going to talk about the hazards of radiotherapy to the nurse and the patient. So I'm going to regionally talk about some of the hazards that we can get after the exposure to radiation during radiotherapy procedures. So the brain, they can be what is called alopecia or scalp arrhythmia. At the same time, ear and external auditory canal can also be affected by radiation. There can be cerebral edema depending on the intensity of the radiation received. Nausea and vomiting can also develop. You can have somnolence syndrome. To the eye, there can be conjunctival edema in tearing. To the head and neck, you can actually find oral mucositis, oral candidiasis, oral herpes, xerostomia, or esophagitis and pharyngitis. So these are just inflammatory processes. Taste changes, dysphagia, ageusia, laryngitis, or dental caries can actually develop secondary to radiotherapy exposure. To the breast, you can also have skin reactions, esophagitis, chest and lung. You can actually find esophagitis, pharyngitis, taste changes, then pneumonitis. The abdomen and the pelvis, you can actually find nausea, vomiting, diarrhea, proctitis, cystitis, vaginal dryness. So there are different effects of radiation to the patient and to the nurse. So as much as it's possible, the ALARA principle has to be applied as low as it is reasonably applicable. We have to give the minimum dose and that is effective. So we also have to take precautions to protect the nurse and our patients. The other aspect that you're supposed to deal with or to appreciate is the effects of HIV and AIDS on patients undergoing radiotherapy. So in the contemporary world, the most pressing concern for oncologists is the potential for radiotherapy cause increased toxicity, especially mucosal and cutaneous, in HIV patients. Early reports of extreme mucositis in HIV sarcoma patients treated with radiation therapy led scientists to investigate whether HIV could be radiosensitizing. A cellular basis for radiosensitivity is supported by findings that fibroblasts from the skin of HIV patients with the sarcoma are more sensitive to ionized radiation when compared to those of health controls. One proposed explanation for this is that HIV induced a systematic glutathione deficiency leading to depletion of radioprotective thiols and increased oxidative stress. In addition, the HIV-1 TAT protein has been found to sensitize rhabdomyosarcoma cells to ionized radiation by reducing the cellular capacity to repair radiation-induced double-stranded DNA breaks and by dysregulating cell cytokine checkpoints. So you can see that the demerits of HIV. So it's more radiosensitizing because the patients they also have immunocompromisation. So we must also minimize radiation exposure to these patients to the minimum dose as much as it is possible, so that we don't affect these patients with radiation. As you know that according to these studies, they have been found to be radiosensitized. So the last aspect on the list is the care of patient radium in situ. So this is a type of internal radiotherapy. So we are saying that when you go to radium is the source of radiation inside your body. How do you care for you as a patient? So radium-223 is eliminated by the body mainly in feces and urine. So if you ingest this radium, or the radium is inside your body, it is mainly eliminated from the body via the feces and the urine. So considering the above, or what I've said, good personal hygiene is the key precaution. Flushing twice is intended to reduce the amount of fecal material in urine that remains after the face flush. So we are saying that when someone is having radium in situ, this is the person who is producing radiation. So he needs an isolation room or a specific room where he will undergo or she will undergo the treatment. So that is a special room where unnecessary people or undesignated people are not supposed to just enter that room because they can be exposed to radiation. So only the people who are managing that patient and wearing essential or necessary protective clothing are the ones who are supposed to manage the patient during the period of treatment. The advice to use separate utensils is also a standard precaution that can be applied. We might need different utensils to remove the urine and to care for the patient or what the patient that they eat, the food they're eating, so that we don't cross-contaminate other patients unnecessarily from radiation. So this is it in terms of radiology and radiotherapy for student nurses. I hope this information that you've acquired now will go a long way as you climb your professional ladder. You must not ignore this type of information because radiology departments are key and part and parcel of the nursing profession the world over. So this information that you're carrying now, you must carry it in your fingertips for the rest of your life. I thank you so much. I thank you for your time. I hope we are going to enjoy your studies, and God bless you all. Thank you.